Today we are going to talk about the health system. Of course, you can't talk about the health system without talking about Corona, but this is not the mere topic of our discussion this morning. Of course, we have to talk a little bit about Corona, but the main topic really is the health reform, where it is and what we have to expect. So, first, I give the word to our partner, which is the East European Foundation. They are the guys who know their way around in Kiev, and we couldn't work without them. So, Victor, you now have the word.
Thank you, Marieluise. Thank you so much. It's a pleasure to be a local partner of the project, which is called Ukrainian Europe. You can find our webpage. You can find more information about what we do in Facebook. In the Ukrainian, that will be Projekt Ukraina v Европі. And the whole idea of the project is to bring together Ukrainian and German, as well as EU politicians, in order to build links between them and to build working relations and share best practices in various fields, as well as to connect and give them opportunities to work together. And indeed, for Ukrainians, it will be a very good idea to bring best practices from Europe and from Germany to Ukraine in various fields. Again, instead of being in Berlin, we launched a whole series of seminars and trainings via online for Ukrainian, with bringing together Ukrainian and German and European politicians to discuss vital issues in their work. One of these issues is healthcare, definitely, and the new reality which we live in definitely demands from us joint solutions and sharing best practices. We have here today probably the best people who can provide kind of objective overlook to the system of Ukrainian healthcare. We have a representative of National Health Service. We have an NGO and we have representative of Parliament. So I look forward to productive discussion and hopefully to get a feedback from German side how Ukrainian system is doing and what we can do better. Thank you so much again for partnership in implementing this project, Marieluise.
Okay, thank you, Victor. So let me start not to give long institutions of all your bias, but just where you're working now and where have been working. I understand now we have Natalia Riabtseva. I hope I propose it correctly. Natalia, she is working at the National Health Service. For Germans, you have to explain that this institution has been set up along with the health reform, which started in 2017. So this is the institution where the payments are being handled for the hospitals. The budget, the national budget is handing over the money to this institution, and they are responsible for how it is spent, including buying pharmacy. So Natalia, I can't see you yet. I see Victor. Where are you? Where is Natalia?
I'm here. Could you?
Hello.
Yeah. Hello. Hello.
Okay. Hello, Natalia. Thank you for stepping in. By the way, it's a female round today, of course, because it's about taking care of people. That's what women do. Then we have Olga Stefanyschyna. Stefanyschyna. Olga, hello. She is now a member in Parliament for Holos. And she has been working on health questions already for many, many years. I have the latest date, which I found, which is 2011. That means 9 years. Nothing compared to me. I've been in parliament for 31 years, but you still have time to go. So she has been working in a very important NGO, which is called Patients of Ukraine. So she has a long experience. I think she was one of those who worked on the structure of reform before it then finally, after the Poroshenko parliament and government hesitated a long time, put it into place, at least with step number 1. And we have Ivanenko. Next picture, I would say, Ivanenko. Where is she?
Hello, I'm here.
Hello, oh, hello, Ivana. Yes.
Inna, my name is Inna.
Inna, yes, you're right, excuse me. I will try to do better. She is the executive director of the NGO, which we already have been talking about, of this Patients of Ukraine, which is representing very, very many organizations and people who are in need, especially those from what I stand who have chronic diseases. And I guess they are the ones that are most interested and most in need for good treatment and a good health system. So, of course, nowadays there is no debate talking without what Corona is doing within the countries, how the health systems are working. But actually our main topic, what we are interested is the health reform. So let's take a few minutes to start talking about the situation, the actual situation, but then going over really to the structural questions of the health reform. In order to give you a little idea, rich Germany with a health system where I think there's 200 billion euro going into it every year, which is an unbelievable amount of money, still was not prepared for Corona. And when it started within the hospitals, it started in a very, very, well, I would say small manner. It took us obviously a long time to understand what we are dealing with. Although we could have learned if we would have looked at China, we had not really realized it. So we started with all the problems other countries have, even having such a good health system, which was even having lack for protection for the medical personnel. And we did not have enough beds in intensive care and so on. We managed within a few weeks getting masks from China. Some of them did not work, were fake news, to use Mr. Trump's word. So not everything was working well here. I tell you that because how could you then expect that from Ukraine, who are working, of course, from a totally different level if you look at the health system. But in the end, we managed pretty good, and you hear that at the moment our situation seems to be so that we can really control it. So let's start with Natalia, who is looking at the reality from her institution. Maybe Natalia, you can tell us in a few words how you estimate your situation is in now. Where is Natalia?
I'm here.
Oh, okay.
Sorry, there was a small misconnection
okay.
of your speech, but as far as I understood, I'm expected to give an overview of what's going on now within health finance progress. Since April 1st, we have started the second phase of the reform.
No, just a moment, Natalia. I'm sorry, you did not hear me. I said no debate about a health system before we have a small spotlight on what the corona situation is at the moment. Okay, so you will then step in with what we are really are going to talk about in a few minutes, but let's have a smart look. We have been having debates to corona, and we are writing a lot in Ukraine, verstehen, on Ukraine also, but still I think we need a small overview to start this discussion, okay?
Yeah. Then talking about the corona situation, we do have comparably small figures now, I would say, comparing to other countries, which we actually relate to the low level of testing. So the assumption is that we have and do not know the real figures. However, the government is going to get prepared for combating the cases. And NHSU, together with the Ministry of Health and Ministry of Finance, is now finalizing the decree which will give us the possibility to contract 3 types of services specifically for COVID-19. The first is additional contracts for emergency care. Second is so-called mobile brigades, which will work in the fields and collect the materials for the tests. That will mainly consist of primary healthcare workers. And the
are they
package,
doing the tests, or are they, excuse me, are they doing the tests as or are they trying to buy stuff on the market to give it and hand it over to the healthcare workers?
That's a bit different. These brigades, they are just getting the material from the, not the material, how it's called, the swabs from the patients, and they bring it to the lab. And then the lab is doing
I see.
the test.
It's about testing. It's about testing. I understand. Okay. Mm-hmm.
And then the tests themselves are mainly procured or provided from the national level. So in that regard, we see the problem that the private labs, they are not fully engaged in this process. So it's mainly for those people who could pay personally for the tests. And the government is still hasn't found the way on how to collaborate in a comprehensive manner with the private lab. Why I raise this question? Because in fact, the capacities of government laboratories are quite limited. That's also one of the points. So they could not produce, up to my latest information, not more than 5,000 tests per day.
Which leads us, I guess, already to the question of how the health system is looking in Ukraine and what you have inherited, excuse me, as the Soviet Union system, and then was carried on for 30 more years, that it is in such a bad shape that you don't have the facilities to test, I understand. And then, of course, we had the race on the international market, buying masks and treatments and protecting stuff for the medical systems, and then for those who work, for example, with elderly and so on. And I guess, of course, this race was bad for a country like Ukraine, which does not have as much money as Germany or the United States have, of course. Yeah, so I see. Okay. And of course, you have little testing, little numbers, a lot of testing, bigger numbers. And I guess then probably you don't have a real idea of how many people have been dying, because I guess in the countryside, people might be dying without even knowing that it's due to corona?
Well, they will. We are doing some assumptions based on available epidemiological and data and medical statistics. In that regards, we are looking precisely on the data about the pneumonia cases and doing some projection like corona is not detected. We could make the assumption that like the cases are rising and it looks atypical. There is a prediction that's due to corona. But
do you have an idea about the factor? Now, what we are fighting for in Germany is to have at least the relation 1-to-1, not one infected person is infecting one other. That's about the ceiling we are trying not to go through. And that is why we have those measurements like lock-in, which is terrible for the economy, of course, even worse in Ukraine, I think. Do you have an idea about this factor?
Well, that is more the calculations done by the Ukrainian Public Health Center. They are now trying to introduce this epidemiological surveillance of potentially contacted and potentially infected people. But to be honest, I don't know to build any model to calculate how many these contacts is actually leading to cases of infection.
Okay. So thank you very much.
They have tried to introduce a kind of mobile application. So the person who is infected put in this application how many people he or she contacted. But last week I heard from the colleague that it's not really successful in sense of kind of promotion and utilization of this application.
Yeah, of course. Okay, thank you, Natalia. Olga, where is she? Olga, you are working in Parliament. Yeah, here you are. I think, please give your perspective. You are a parliamentarian, you are opposition, you might be able to be a little more outspoken on what is not working well or what is working well, what is not working so well. And from what I learned, that you have brought in an initiative into Parliament now, that the situation of the corona workers, let's call them that way, is going to be eased. Please tell us a little about it.
Well, let me firstly tell a brief overview of the statistics which is available in Ukraine. So Ukraine announced quarantine on the 12th of March. So now we are more than 1 month, almost 2 months on quarantine. And each day officially we have up to 400 new cases which are registered by the Ministry of Health. So basically we have almost 10,000 people officially registered as infected with COVID-19. 250 of which are lethal. So this is the overview of these statistics available from the Ministry of Health, but I would agree to Natalia that of course the statistics is quite low, and there are much more people infected with COVID-19 about which we don't know due to the fact that the government didn't implement the testing system. And Ukraine is now demonstrates the lowest rates of testing in Europe. We have only 1,500 tests per 1 million of people, which is quite low. That's why it's difficult to say how many people are infected and how many people died of COVID-19. So I'm thankful to you for allowing me be more outspoken, and I will use this opportunity, of course.
That's what the opposition is for, my dear.
Yeah, but to tell you the truth, it's unfortunately so that there is nothing to be proud of for Ukraine in combating COVID-19, and the situation is really quite difficult. One good thing which was introduced by this government is that they introduced this quarantine timely. So I would say that this helped a lot to a little bit hold the spread of COVID-19 in Ukraine, but the government didn't use this time, which is almost 2 months, to prepare the system. We know that the best practices in Europe and other countries show that the quarantine is not a remedy. Quarantine is the time when the government should do their best to prepare the system, to test, to make these testing algorithms, to protect the doctors. I would shock you probably, but 20% of all infected people in Ukraine are doctors.
Yeah.
And this is a very difficult statistics. I know that there are only, if I'm not mistaken, 2% of medical doctors infected in Germany. And even
but 30 in Russia, I guess. So, okay,
yeah.
Yes.
And even in Italy, who underwent the peak of corona in their practice, they have 10 times less infected doctors than Ukraine has. So this is quite worrisome, and we really would urge the government be more active. And our party registered a legislation which will give an opportunity and will foster the government to launch the wide testing system. So they should develop algorithms based on the best practices of WHO and CDC, so that more people can undergo their tests. Now it's difficult to be tested on COVID in Ukraine, both by governmental facilities or by private one, which Natalia said. Second issue is doctors' protection. First, our doctors don't receive full salary when even they are on isolation, and we suggest to increase to give them the full salary, even if the doctors are isolated because of COVID. Secondly, the Ministry of Health should develop protocols of testing and also other processes which are connected to COVID. Doctors have no clear instructions even how to operate with protection suits, how to work on their facilities, and that's also which the Ministry of Health didn't do during this time. But the worst is that our facilities are not provided with necessary protection suits and masks and everything. And I would agree partially that it could be connected with the fact that there is a worldwide deficit on the international level, but also in Ukraine there is a specific feature of Ukrainian reality is that we borrowed from previous times before the Revolution of Dignity, when there are not efficient use of budget funds. And now we, as an opposition, raise the issue of inefficient use of budget fund by the Ministry of Health, because it seems that there are practices which can show on corruption even during the protection or the procurement of suits for doctors. We had a very big scandal last week when the Ministry of Health tried to procure suits for the doctors which were 2 times more expensive other institution can provide. So
that's the old story. The old story.
Yes.
Yeah.
And this is even this is such a root practice during these epidemics and during these hard times for all the ones, when people can come to the ministry and try to use these practices during such a difficult time. So we are now pushing this issue not to let this practice spread all over Ukraine, because this is really what we cannot tolerate. And the last issue, which is also very important, that we don't know even how many tests are there in Ukraine, how many these special devices for artificial ventilation, how many suits, how many hospitals are prepared. So part of this information can be provided by National Health Service, but not all of it. And we will oblige the government of Ukraine to be transparent by our legislation in all these issues as well.
Okay, thank you. Maybe not so easy for a ministry which has had so many short-time ministers during the last month to have a house, like we call the ministry, running really well. Okay, I mean, what you tell about this corruption is terrible. We have had the problems that the prices on the world market are climbing extremely, and masks which you could go buy for nothing in normal times immediately went up very high, but corruption in it then is something different. Okay, so here we are with Ivana, and I think from what I learned about Ukraine, Ivana, you have been working, I read, in the HIV topic. And I remember when Maidan was still running and I visited some of your activists, those who were working against corruption came out of this HIV system, because the HIV procurements for those people who were infected came from international companies, and they asked young people in Ukraine to somehow make investigation where the money was going. And then they were finding out that if the money is really used correct, you can really hand it over to 2 times as people as before. So this topic about corruption in the medical and procurement system seems to be a very old one. Ivana, you are, I still don't have her in the picture.
I'm here.
Here, thank you. Now I have you. You are CEO in this Patients of Ukraine, and I guess you are what we call civil society, which might get even more important now, or even a revival in times when there is another such existential fight for the people in the country.
Yes, initially our organization, Patients of Ukraine, is an advocacy-based, is a patient-based advocacy organization. And what we did all the time, we pushed for positive legislative changes, which ensured access to treatment in Ukraine. But when coronavirus came to our country, we understood that the government is doing nothing. The doctors are in desperate situation and they are absolutely unprotected, and only volunteers and the business could do something in order to help hospitals and to help doctors. And 5 weeks ago we have launched a volunteer project. It is called Let's Unite Against Coronavirus, and we said that now Patient of Ukraine is a platform where business that wants to help the hospitals will meet together with hospitals which are in the need of their help. So we, at the moment, we receive donations on our account in order to procure personal protective equipment for the doctors and deliver it to the hospitals where the most urgent need is. And also we navigate the business which want to help and to donate something to those hospitals where is the need, because we are in close connection with the hospitals and we understand their everyday need in, first of all, in personal protective equipment. We have almost 200 volunteers engaged in our project from Kiev and from all regions all over Ukraine. And during these 5 weeks, we have already helped 88 hospitals from 18 regions. Yes, I absolutely agree with Olga that unfortunately in Ukraine it is a very unique situation when every 5th person with coronavirus, it's a doctor, it's a medical worker. They need our protection every day, and as we are an advocacy organization, we advocate for this protection as well, especially when we see that the Minister of Health buys protective suits twice expensive than we do. Of course, we...
May I ask you, may I interrupt you? Does that happen to be the firm of his wife, which is buying those suits and the equipment? Because what we learned when Mr. Stepanov was starting being minister, his wife immediately set up a firm to buy medicaments and procurement.
Not right that. We have already a state enterprise in Ukraine, which is called Medical Procurements of Ukraine, which was going to buy everything for coronavirus, and they were having a very good proposal from the market, from the Ukrainian manufacturer, but when they started to sign a contract with the firm which won the tender, the Ministry of Health took this tender in their hands and bought the costumes from China, and twice more expensive. And they changed the specifications for these costumes at the last moment. Then we tried to find the costumes with the same specifications as Ministry of Health asked to procure, and we have found it in Ukrainian market from Ukrainian manufacturer, and twice more cheaper than the Ministry of Health have bought. They already bought it, and now we know that they plan to buy ventilators, and we are also afraid of this procurement, as we also suppose that it will be again much more expensive than they are in the market. Unfortunately, we come back again in 2013 with the corruptive schemes in the Ministry of Health.
Yes, this is what I think one has to conclude. I think you can't blame a system which is in a poor country, and Ukraine still is a poor country in Ukraine, that they don't have the facilities, for example, which we have in rich Germany. But if there is a need and there's possibilities to act, and then you have an information like that, a poor country buys twice as expensive as it could have bought in the own nation. This is really a scandal. Is there public reports on it? on those information? I mean,
We
in Germany, the people would kill the government if informations like that would become public.
It is public. We have had an online press briefing as soon as we understood the situation, and everybody knows about that, and even the president of Ukraine knows about that, but nobody is doing nothing, and they even allow to the Ministry of Health to procure ventilators again. And it's in the situation when we have in our country already very effective procurement mechanisms, which were launched 6 years ago, because the international organization 6 years ago started to buy medications instead of Minister of Health within the state budget. It was a special law allowing them to do that because of the corruption in the Ministry of Health.
Yeah.
Already for 6 years, the patients have access to treatment. The international organizations make very good savings on their procurements and buy more and more medication. So it's already very working and very good mechanism. Why don't you use it? And I don't know. And the Ministry of Health tries again to return all the procurements in the Ministry of Health, maybe because they want to raise money on that.
Okay, thank you. So actually this is leading over to the next subtopic we're going to talk about. Maybe to those people who listen, there will be the possibilities to put questions. Maybe we come back to the COVID-19 then, but now I would like to use the time to really deal with the topic which we want to talk about, which is the reform. Just a few sentences, since we are today talking to the German public. It should not surprise us that in 1990, Ukraine was left with the old Soviet system, which was totally centralized and hierarchical and seemed to be good maybe in the 70s, but it definitely was not good anymore in 1990. And for many years, nothing really changed. And what you had was a system which on the paper was giving procurement for no money to everybody in a just way. The reality was totally different, and everybody has somebody in his family who has cancer or chronic diseases or other experiences. That reality was, if you wanted a good treatment, you have to pay yourself. So there was a big debate, and I think you, the NGO, prepared it for some time, the structures, also Olga, from what I learned. And finally in 2017, you voted after the resistance was pretty big in Parliament, but finally you voted for that reform, which is linked to the name Mrs. Supun. And from what I learned now is that the problems which now show up with COVID are linked to this health reform, and you have a president who went back and forth on his judgment on the health reform. When he was campaigning, he said, it's terrible, I'm going to go back to the old reform. Then when we had this discussion with Poroshenko, he said it was the only good reform. And now he says, and I think must scare you a little bit, the health system now shows, if you look at how it treats COVID-19, that we have to change it again. So let's look at what has happened since 2017. Natalia, you are an active part of the structures which have been set up. Maybe you tell us what the structural changes were, what the ideas were, what has happened until now, what is supposed to happen, and maybe a few hints on the reality and where the system is a system, but reality is a little different. So, Natalia, it's your turn to help us German guests to find into that complicated manner. It's very complicated in Germany also, to tell you. If anybody wants to change the health system in Germany, there is huge debate and everybody's excited because, of course, it gets to your personal well-being. So, Natalia, can you give us a little lecture, a little teach-in on the reforms which have been undertaken in Ukraine?
Yeah, thank you very much. I will try to be short, but then in case of any questions, I will be happy to answer.
Yeah.
So the reform has started in 2017, and it aimed actually to decrease the catastrophic financial expenditures of the population on the healthcare and to move towards universal health coverage. In that time, and I presume that this figure didn't change much still, up to 90% of population was afraid of getting into debts due to health issues. And that's why having probably the most overloaded hospital system in the country, with the highest number of beds all over the Europe, we still had probably one of the worst health outcomes. So the reform aimed, like we call it health financing reform. So it doesn't tackle all the issues in the health sphere. But our intention was three main things. The first is to define a clear health benefit package. So the people really knows what the state guarantees to them and what in should be paid by them directly, but officially, not like now, like it was before. The second was to introduce a single and strategic purchaser of the health care to ensure that this purchasing and the payments for the health care is done in a really strategic way, and we could prioritize specific types of the services and not to spend for the care on, let's say, stroke and heart attack twice less than the government pays for the stomatological care, which is ridiculous. Then the third part of the story was to introduce a new relations and new possibilities for the health providers, to give them more managerial authority and independence, and to introduce a direct relations between the purchaser and the providers, to decrease the corruption in the system, but also to ensure that we have the mechanisms, the payment mechanisms, which incentivize the provision of care, but not just kind of input-based. I have big number of beds, so I have lots of money independently whether I have the patients. So that were three main points. In 2019, the National Health Service of Ukraine was established as the single strategic purchaser, and we started the reform at the primary health care level. We have decided to do that because the primary health care was dramatically neglected in Ukraine. Only 1/4 of the patients contacted the primary health care when they had any need in health support.
Excuse me, may I introduce you? May I ask, primary health care, does that mean the first doctor who you address? We call them home doctors, house doctors, you know, that's where you usually have a relation of confidence. They should know you. They don't maybe, but they should know you. In smaller cities, they know you, and you choose your doctor of the one who trust.
Yeah, absolutely.
Yeah? Okay. Yeah. Okay.
And we decided to improve the situation in Ukraine because we know from many countries that that's really effective both for the health and for the economy. Then the second step was done in 2019 when the National Health Service took over the national reimbursement, medicine reimbursement program for the essential medicines
it's real life in your bag.
Most,
I see it.
like, yeah, sorry.
Whereas
most of us are working from home now.
Yeah. Everything's fine.
Yeah.
Okay.
So we introduced this reimbursement program through the electronic prescription. So the patients who have a hypertension, asthma, or diabetes, they could get the essential medicines they need during all the course of the life from their family doctor with no copayment or very small copayment. The good thing here that due to electronic tools, now they could also have the recurrent prescription by phone. So they don't need to go to the doctor. And also during the last year, we have tested in one of the regions the approaches to contract the specialized and hospital care providers. And we have, based on that, we have developed all the administrative and contracting mechanisms, the payment mechanisms, and we have, with the support of many experts, developed the first health benefit package for Ukraine for 2020. We call it Program of Medical Guarantees. And
Program of, excuse me, the line was bad. Program of
Medical Guarantees.
Medical guarantees, yeah. Okay.
And it various types of the care, and we started the introduction of the new contracts since April 1st. And answer one of the arguments you mentioned that, well, probably there was not a time, and now with the COVID, the reform could not manage that, and so on. Our position is very strict here. We believe that the big trouble Ukraine have now with the COVID is because of the old system that was not actually reformed and not prepared to answer such kind of challenges. And now having a direct contact with all the facilities, we could much easily manage the situation. Even the new minister now turned to us, considering all the questions and we have now with the Ministry of Health, but the minister refers to us and say, I would like to channel most of the money through the National Health Service because I could not rely on the regional administration on how they spent the funds. They are doing that like based on their knowledge, and that is not always the best solution. So having direct contracts with the facility, we could react faster and we could control, and we could also adjust when it's needed based on the situation. Okay. And that's why the Ministry of Finance actually emphasized that this new contracts for the COVID-19, both for emergency, for mobile brigades, and also for the hospital care, should be channeled through the National Health Service of Ukraine, because we could ensure the transparency and effective use of these funds.
Thank you very much, Natalia. Having been in Parliament for so many years, I've seen many reforms of the German health system, And I can tell you this main idea, the money follows the patient, is something which is not always working or has been working well in Germany also. You know, especially this debate which you have that there are too many empty beds in hospital, and if you pay them for an empty bed, I mean, what would you do as a doctor or a nurse? You know, it's much easier to get the money for empty beds than for beds where you really have to work. And then you start stirring up the population and say they are reducing the beds. You're not going to get a bed anymore when you are in need, and so on. So I tell you, it's the biggest playing field for fights in Germany. And I really know how difficult it is to make reforms in the health system and how easy it is to stir up people's emotions, especially when they don't know the facts and figures so well. So I will now ask Olga, who knows all the system, has taken part developing it, maybe talking a little more free than Natalia is, to tell us where the system did not work, and then also give us the political idea whether this reform government, Zelensky, like it started, whether we can trust that they are really going to go on with these reforms, or whether the signs are already looking backwards. And even the new deputy reform prime minister, which you might get, called Mr. Saakashvili, might not be the one to really work on that precisely. Olga, what is the practical part of it? Did it work well by all the kids' diseases which a switch in reform must have? What's your estimation on that?
So let me start first from the very beginning. I will just briefly say how the idea of health reform was born in Ukraine. And at the very beginning, you told a little bit about my biography, and it's really so. I am in this area, I'm working in it from 2007. I had an experience of looking into this system for many years, and from patient's perspective and from the ministerial perspective, now from a parliamentary one. So when the revolution of dignity happened in Ukraine in 2014, we as patients advocates were working with different stakeholders, international organizations, which were World Bank, WHO, and Soros Foundation in Ukraine, to develop a strategy of health reform in Ukraine. So it was the very start when the idea of health reform was born, because we inherited post-Soviet medicine, as Natalia has already mentioned. There was total lack of money and very high out-of-pocket expenses. So people in Ukraine basically paid for everything in the hospitals, and they also paid their taxes to the government, which paid for the beds which were not used by the patients. So that vicious cycle should have been broken one day, and it happened when there a political will was born in Ukraine, and Uliana Suprun was appointed as a Minister of Health, because before that we developed a lot of concepts and strategies, but no one dared to start implementing them. And that was in 2016 when Uliana and her team came to the ministry and started working in practice to implement healthcare reform. Legislation was approved by the parliament. It was very difficult to advocate for it, but both Ministry of Health and patients' organizations where I was working at that time, along with Ivanenko, who is with us now, we really pushed Ukrainian parliament to approve this health reform. And it started being implemented from primary healthcare. Natalia described it very well. And I would say that it really worked very good. Around 70% of people who have who declared that they used primary health services are satisfied with healthcare reform. And now we are on the Rubicon when healthcare reform should be spread on secondary and tertiary specialized care. But in 2000, I cannot hear you.
Excuse me now. Yeah. Specialized here means hospitals.
Yes, it means specialized hospitals of all levels, different ones, and it is hospitals where people stay, and also where they receive some services like cancer hospitals or hepatitis treatment or others. Yeah. So in September 2019, political turbulence started in Ukraine. The government was changed. You know that we had elections, and totally new people came to the government. Maybe no one knows, but during that time we already have third Minister of Health. So one was appointed in September, the next one was appointed in February, and now we have the third one, which is 1 month on his post.
But he's at least a doctor, from what I learned. He is a doctor.
He has education, but he didn't work as a doctor, and he didn't work in the area at all. So the problem is that people who come on that post, they actually were not in any of the teams of health reform. And first they need time to understand this reform. Then they understand that it's not a politically sexy reform, so to say, because it really is a very difficult reform for everyone. And then they try to oppose this reform, but finally they understand that there is no way out and they put up with this reform, but then they are fired. So in this reality, it's really difficult to bring this reform through all this political turbulence, and it's very important that we have this health reform champion, which is National Health Service, which Natalia represents, which is the institution which is the symbol of reform. And those people who are working there, they really are trying to push it forward by professional work, and I think that that institution is one of the key institutions which symbolize the reform.
One question, Olga. Something which I should not ask Natalia because she can't talk about it, but you can talk about it being opposition. We learned that, I think in December, the man who was the head of this National Health Service resigned. So there must have been signs that something did not really work out so well.
Yes, and that's what I wanted to continue with, that we lost a lot of reform champions, and a lot of people who were working at the Ministry of Health and at the National Health Service, like Olga and Public Health Center, left the system, unfortunately, because it's very difficult to work under the absence of political leadership for the reform, and we see that a lot demotivation, which bring you and new minister. it results into losing the reform champions like Olga. So this, of course, makes a lot of obstacles to implement this reform. This reform is very difficult even when there is a political will. But when there is no political will to implement it, it becomes more and more difficult. The current minister, who came on his post a month ago, now decided to make an audit of the reform. Which also gives us a sign that some steps could be taken to halt or even to cancel some phases of this reform. But what are the main problems? One of it is the very big resistance of the system itself. I mean, doctors, there are doctors of big institutions who, of course, used to live according to the rules when the patients paid thousands and thousands of dollars out-of-pocket expenses to their hospitals. Of course, it's difficult to relieve all these changes, even for good managers, because you have to reorganize all the system. And even for those doctors who are willing to change, it's difficult, and they need help and guidance from the Ministry of Health, how to better do it. The point is that we have, so to say, doctors-in-chief in each hospital of Ukraine. And those doctors-in-chief now should become very good managers. And to become very good managers, they should be guided by the Ministry of Health, by local authorities. And for this, the ministry should have political will. And a second issue is poor communication. Unfortunately, when there is no clear vision from the highest authorities in Ukraine how to implement this reform, both technically and politically, there is no clear communication both to the people and to the doctors, how the system will work. Actually, no one understands at the moment which services are for free, which services should be not for free, how the doctors should organize the system, etc., etc. So that brings us to the very, frustrating situation, because the Ministry of Health, due to this change of the minister, a poor understanding of the reform, actually didn't prepare the system well. And those very strange and dubious messages from new Minister of Health bring much more doubts about the future of the reform. But of course, we're here as a parliament to control it, and of course, we're here as a parliament to support the development of this reform. And I would tell that. Despite the fact that I'm in the opposition, I'm happy to say that the parliamentary committee and its head, who were quite cautious and sometimes very opposition to the reform, now are supportive. And that's a good news that the parliament during these months got to understanding that there is no other option for Ukraine, in fact, as to implement these methods of payment. And of course, we should work together to finding more money for healthcare, because, as you said, we're quite poor country, and there's only 50% of need in the budget of Ukraine to cover all the necessary services. But even this money, in case they are not enough, they should be used effectively. And that's the essence of the reform. Those money which are there should be used effectively. And I think the parliament is one of the driving forces, together with NHS, together with patients' organizations, to persuade Ministry of Health and the new minister that there is no way out and they should continue.
Yeah, thank you, Olga. Since we have been following the process quite a bit, what we learned is what is really a very strange habit, and I hope that someday the country will really change in that aspect, that when you have a new minister, the first thing they do is clean out the ministry and send those experienced people away and get their own bodies in there. And this is something which I always try to tell, that a ministry actually stays as it is, no matter who the minister is, because they are servants of the people, to be honest, servants of political decisions which have been made, servants, period. And so this learning that people have been coming and going, of course, makes any reform almost impossible, and especially one where the possibility to stir up the people by telling them the story that you better watch out, you will not get any treatment anymore, makes any reform almost impossible. I mean, what you, in being parliamentarians, what can say, what we can tell you, Germany, who has a big lack of doctors, especially in the countryside, we are glad to take Ukrainian doctors and nurses. And if you have salaries from 100 to 200 euro per month, unless you create your side pocket like others did, but if you have the ethical doctors who says we are not going to do that, they in the end migrate to one of those European countries, and we are more than glad to take them, yeah, since we didn't even have to pay the money for give them the medical education, which is costly. So I hope that the political debate in Parliament will be strong enough to tell your president, show your president that he can't go back to the old system or to a private system. Now, Inna, yeah.
One more remark. How much time do we have? Because I have to go to the cabinet.
Okay. Can somebody, Mattia, can you tell us, or Julia, how much time we have?
Yes, we still have like some 10 minutes. That's why if
10
possible,
only.
10 to 15 minutes.
Okay.
If possible, I would also switch to questions.
Okay, but let me please give Inna the possibility, because she hasn't had a turn now. Inna?
Yes, yes.
Are you still there? Okay. A few remarks on what Olga has already said from the practical side, maybe.
Okay, I will tell about from patients' perspective. And as Olga said at the very beginning, our organization was one of the initiators of healthcare reform in our country. And of course, we protect it, but we protect it not because it's like our reform and our idea, but because we have feel already the result of the first stage of reform, when all the patients have the possibility to choose their family doctors. Now we didn't have this possibility in our country, and now everybody understands that when you are going to the family doctor or the therapist, you will not pay under the table to the doctor, and everything is for free for the patients. And of course, everybody is waiting for the second stage
Yes.
of the
Inna,
reform in the hospitals.
Yeah. One direct question. I got the information of a friend of mine that he's waiting since 4 months for his procurement for cancer. The health organization could not get and could not buy the pharmacist needs. Is that
No, as for the procurements of the medications, as I already told, international organizations do the procurements for Ukraine, and especially in cancer, we have a very good situation because in 2019, British agency, Crown agents, were dealing with procurements of medications for cancer, and they did it very well. They have savings about 20 and something $million, 26 if I am not mistaken, and they bought even more medicines for Ukrainians for these savings. So with cancer,
it's misinformation.
We have very good situation.
So,
and patients really, they wait that the reform will come to the hospitals, and we have already months when the reform was officially launched, the second stage of the reforms. Of course, the problems remain, and this is normal because we have a very huge network of hospitals that should reload themselves. And we as a patient organization, we have members and representatives in the region which who tell us that still the patient pay for the services. Doctors take bribes, and the patients are disoriented. They don't know for what should they pay and for what they should not pay. But it's 1 month, it's a very short period of time, and the positive is that the representatives of our organization, they are patient leaders, and all of them understand that this is a temporary phenomenon, such difficulties, and we are thinking now in the organization to make an ambassadors of the healthcare reform from our members in order they do in the region some, educated work of inside among the patients and among the doctors.
Okay. Thank you very much, Inna. So now we have been talking so intensively that those people who want to ask questions were a little bit pushed aside, and I heard, got the hint that Olga has to leave.
You would have only...
Does Olga have to leave? Olga, when do you have to leave? Then we will take the question for Olga first, please.
Yeah, I have around five minutes, maybe
5 minutes, okay. Yeah. So the first questions which are addressed to Olga, please give them to Olga because she has only 5 more minutes.
Yes, we would pose like 3 questions, and then Olga can answer on them. The first one would concern the medical education, because the educational reform in that concern did not start yet, and the corruption is still high. Lastly, in 2019, the International Foundations of Medicine tested the competencies of 4th-year students in medical universities in Ukraine, and only roughly 27% of them passed the test, and only 1.5% of those who passed reached 50% of the test. So the competencies of the medical students are not up to date in Ukraine. The second question, so the question is what should be done with that, and when will this start? The second question would concern the east of Ukraine. The NGO Vostok SOS surveyed the east of Ukraine and reports a catastrophic situation in the hospitals in Luhansk Oblast, particularly. The hospitals are staffed with as little as only 60% of skilled workers, like 40% are not enough, 60% are not enough. And the average neuro specialist is 72 years old. So there is a lack of personnel, and then there is a lack of equipment, lack of diagnostic tool and disinfection, like basic tools like disinfection. What should be the government, the parliament response to that, and the civil society response to that? I think in Donetsk region, the situation might look quite the same. And the last question would concern the exit strategy. How should it look like, the exit strategy from the coronavirus lockdown? Because this lockdown, which will last until the 11th of May, only gave some time the medical system of Ukraine. And after the lockdown will be stopped, the medical system will still be under fire.
A lot of questions for 5 minutes, dear Julia. Okay. Olga.
Well, I will try to answer all of them shortly. Concerning medical education, the person who asked the question is absolutely right. And our team, when being at the ministry, we developed different new tools to test the students, as well as to give the possibilities to medical workers to have, we called it, one second, English. You gave an opportunity to develop, to professionally develop all the time, so to say. So we gave them financial resources to step aside the Soviet system of increasing their KPIs to more democratic and modern ones. But you know what? We had a lot of demonstrations in front of the ministry, both from the students who didn't want to pass any tests, and they blocked actually our work because they said that those tests shouldn't be that much severe. So my opinion is that, of course, the quality of medical services depends greatly on the education of medical workers, and that's one of the cornerstones of medical system. And everything we launched together with our colleagues, and we had this prominent doctor in our team, Alexander Linchevsky, should be continued. About the east of Ukraine, I would probably give more possibility to Natalia to say about the situation in numbers on those territories, but of course a lot of attention should be paid by the Ministry of Health to these regions, because some of the hospitals stayed at the territory which is not controlled by Ukrainian government anymore. So there are parts of Ukraine where we have not enough hospitals at all. And of course, probably some new hospitals should be built there. More finances should be allocated to those territories, and they should be under special attention of the government of Ukraine. Talking about coronavirus, I would not be that much optimistic, probably, because I perfectly understand that the exit of this situation will be on our tables when we will have vaccine, and it will take a lot of time. I don't know for sure, but probably 1 year will pass. 1 more year will pass when we will have a vaccine. And during this year, we will have to get used to live on entirely new rules, on social distancing, on helping hospitals and doctors, on quarantine from time to time. So even if the government of Ukraine will stop lockdowns in May, it can lead to more infections, and then we'll have to react. So first thing which should be under governmental control is a testing system, and that's why we developed our legislation. Second, of course, prepare the hospitals, because those peaks of epidemics can come to Ukraine in any time, and we should be prepared. And of course, people should learn to live on new rules. That's much more easier for European countries, because in those countries people listen to the regulations of the government more. But in Ukraine, I think we should look into our Western examples and really help the government by our behavior change, not to let coronavirus be aggressively spread all over Ukraine.
I hope we meet from person to person pretty soon.
In 1 year.
No, that can't happen. The economy worldwide will be, we are back in the Stone Ages if we have to stay in isolation for 1 year. Thank you very much. I don't want to keep you from running. Thank you. And I hope we see you again, because we want to go on with this talk together with German parliamentarians who are engaged in the health system. And I hope we can see you again then. So go and run. Ivana. No, there's more questions. Excuse me, Julia's turn now. Thank you. It's Julia's turn, bringing in more questions.
These three questions. These three questions are also posed to Natalia and to Ina, and then we have to finish.
Okay. So Ina, it's your turn. Do you know how the stepping out of Corona will work? Which nobody really knows. Enough.
You know,
yes.
We have had already an example when the government make, the possibility for markets, food markets to work. And everybody understood that the markets, they don't keep the rules of quarantine, and very soon they closed again. But today on the cabinet of ministers, I think they will again try to open the markets, food markets, and we will see how it will work. If the people will understand the importance of these new rules, and we will see on practice really.
Do you force,
and this will be, yes?
Do you force the people to wear masks in the room or not? Not yet. Because in Germany now,
with connections, can you please repeat?
Is there the rule to wear masks in the public room when you go to a market, for example?
Yes, of course.
And so, of course, you say, okay.
Of course. Yes, 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 of course. We have these rules when you go, for example, to the food store, you have to wear a mask, or to the pharmacies, or any public places which are open now in Ukraine. When you visit them, of course, you are obliged to wear masks. And really, yes, everybody is doing that. But at the same time, there are a lot of people on the streets, playing with children on the streets. So, Ukrainians, they don't obey very strictly the rules of the government and the rules of the quarantine. So I would agree with Olga that in a year I think we could come back again to our normal life, and this year we should learn how to survive with new rules.
Thank you. There was a question about education, medical education. From how I understood, I do not know whether we can really touch this topic sufficiently. It's a big one. Do you want to have? I mean,
it's it's not the focus of our organization. That's why I can't comment on it. And if to talk about Eastern region, the situation is not good in all hospitals in all regions in Ukraine, especially those hospitals who are on the peak of coronavirus. It's mostly hospitals from Western regions in Ukraine, and we from on our fund we try to first to help those hospitals which have a lot of patients with COVID, and to take all need equipment and protective suits and everything the hospitals need first to those regions and those hospitals.
Thank you. Thank you, Ivana. Also, the same to you. I hope we will meet in warm bodies, like you call it in the States, again. And Natalia, you have the last and final word. No, the last and final word is to Victor, but you have still the possibility, if we can get you in. Where is Natalia?
Yes.
Yes.
I will add on what colleagues told in the following way. Actually, the situation in the hospital sector is really difficult for all over the country, but we see very positive examples from both main part of the country and the areas which are affected by the conflict. I would say that in many cases, the success or failure of the facilities depends not only on the local conditions or peculiarities, but also on the involvement of local authorities and the managerial capacities of the manager of the facility. As an example, what we see, let's say, for the delivery care, which is, let's be honest, it was one of the most corrupted in Ukraine. Most of pregnant women paid to the doctors to have the delivery. Now, with the launch of the second phase of the reform, we already have signals from the hospitals that now they start to provide this service for free to the patients. And that differs, like you could have a good big hospital, one is still taking the bribes and other not. So we are now monitoring that and following that. Coming back to the Lugansk example, I mean, they are really in a very difficult situation. And that's why we also raised several times in front of the government the question that they need a special attention, both from the government level, and it's not only the part of NHS work, because we have like, I would say, limited responsibilities and duties. We could not answer all the questions they have. But what we see from the previous times, like with the reform at primary health care level, that at this territory, there are positive cases and negative cases.
Now,
to contribute the part of the job. I would say that to support the hospital for the priority services, We also need a very big support from the Ministry of Health, because they are still responsible for so-called national procurements of very important medicines and devices for stroke, for heart attack, for neonatal care. And if this part of resources is not distributed to the hospitals, the payments we do for the medical care would not be enough. Because this is for the time being, and that will also affect significantly people at the conflict territories, because I mean, let's say in Kiev, you have more possibilities to go and buy some goods or some medicines if you need it, which is much more difficult in the conflict area. And that's why, like, my vision is that here we need, you know, to unite the efforts of different stakeholders to find the answer and to find a good solution and the correct financing as well. And this policy should be straightforward. It should not be changed at, you know, every week or every month, because it makes people uncertain what they have to do. Also, like the business, for example, in many cases, investing in the development of the system, they want to contribute and help, but as soon as they have different messages from the ministry or from the government or from the president, they just, you know, step back and wait until everything will be clear. And especially in Corona situation, this is as well pretty much important, because our exit strategy will also depend, I would say, simultaneously hard on economic situation and on the capacities of our network. We know that in fact the network now is not able to ensure the care for more than 60,000 hospitalized people, which is not like a big number looking at neighboring countries, looking at what's going on in Europe. I mean, with such number of people in the hospitals, the system will be stuck. So we will just not be able to provide care. That's not only the question of equipment, this is also the question of the medical personnel. That's why, you know, I don't really like this populist message that, well, the medical professionals will be fired or something like that. The system needs these people. I mean, in this situation, probably with very small retraining, they will be really helpful and contribute to combating the epidemic. So I would say here we have to be like, we are doing our best, you know, providing the recommendations to the government. We also provide recommendations to the facilities based on international standards and international recommendation on what to do with the COVID in facilities and so on. But we really need to unite all the national and regional stakeholders to be consistent in our communication and in our measures we do to find the best solution for the country.
Thank you very much, Natalia. I think some of those questions we don't really have the real answer worldwide, how this coming out of the exit and this balance between being able to take care of people who get ill, but also the necessity of keeping economy or going or starting it going again is very, very difficult, and nobody has a clear answer. I think the good news is, from what I've heard, that the parliament seems to support the reform. This is good news. So, Victor, maybe for us, a new push and to bring the parliamentarians together. What do you think about that?
Yes, indeed. Thank you very much, everybody, for a valuable contribution to the discussion. Indeed, we need three pieces of society like Parliament, executive like National Health Service and Ministry, and civil society organizations like Patients of Ukraine, working together to develop the reform and advancing reform further. Because probably you understand from all kind of contributions that cost of slowing down or cost of doing nothing is extremely high for Ukrainians. At the moment, Ukrainian health system is extremely expensive. I mean, from budget-wise, for all budgets, from national level budgets as well as local budgets, and in some cases, even private companies, they're donating resources because, again, system is not efficient, and we need to definitely to work it out extremely intensively. And the way how government at the moment decides to form institutions like National Health Service, which is from structural point of view and from kind of the nature how they work, they're representing in new standards. This is a very efficient practice. I would like to point only kind of two issues here. First, we definitely need to communicate reforms. Healthcare reform is one of the most needed and most expected by Ukrainians. But at the same time, people don't know a lot what kind of new opportunities they have with new primary health care reforms, etc. So communication first. And second point, I would like to stress that civil society organizations and wide monitoring over and public oversight of the activities of different kind of stakeholders, including Ministry of Health, National Health Service, and Parliament should be in place. In this case, I think that we can advance the reform. Again, thank you so much for a valuable contribution.
Thank you, everybody who helped, assisted, brought us together. And I hope we will see each other pretty soon.